So I'm here at Dr. Newman's office, and we'll see how long I have to wait before I see him. But it's nice because every other time I've come for an appointment, I've had either it was me and the kids, or me, Vic, and the kids, or me, my mom, and the kids, and like they're not super stoked on kids at the office, which it always makes me like instantly dislike people if they are not okay with small children, because small children are small children and they're crazy. But so hopefully no one can hear me. But I'm gonna ask him about how long it's gonna take for this one to drop, because I don't know if you can tell. Boob shot. It's higher, so I don't. You can kind of tell, but it's like all the way up here, and this one is down here. So there you go. But I was telling my mom when I was on the phone with her that when I was in the Navy, you always have to have your right hand available to salute. So I carried everything in my left hand. So even though I am right hand dominant, I actually carry everything in my left. So when you have the implants under the muscle, sometimes it can be harder for them to drop on your more dominant side. Hey guys, so if I have figured out how to edit anything, because I don't know how to use any of the software yet, hopefully this video will have started with a clip from when I was at my plastic surgeon's yesterday. So today I am 9 days post-op. In the clip that I took yesterday at his office, I'm like talking away, and then he comes walking in, so I like shut down. So sorry about that, with like no transition. So I went yesterday, like I said, and so I was 8 days post-op at that. That was my second visit, and so he comes in, and he was just like, how are they? And before he even looked at me, he was like, so your left implant is sitting higher than the right. And I was like, yeah. And so apparently that's a thing. And from other information that I've gotten, watching other people's videos, what generally happens, I guess, is that on your dominant side, so for me, I'm right-handed, that sometimes that can be the harder one to drop under the muscle because you're using it more often. And so that muscle is a little bit harder to release. But on the flip side, the left side, what he was saying, is generally a narrower pocket naturally. And so it's a little bit more difficult to get implants into. So on top of that, because I was in the Navy for 6 years, although I am right-handed, and so like I do most things with my right hand, in the military you salute with your right hand, and so you can't carry things when you're in uniform in your right hand because you need it to be free to salute. So I have gotten into the habit of carrying my purse, carrying the kids, carrying my water, carrying everything in my left hand. So I have a sneaky suspicion that the reason it won't release as well as the other side is because that is actually my stronger side. So that muscle is a little bit more developed, and therefore a little bit more pissed off that I shoved a 575cc pillow up underneath it. The only pain I'm having right now is this right here. So, God, I'm getting my master's in sports and health sciences, and so you would think I would remember what that muscle is. It feels like my pec minor, but it's like this whole situation, and it's connecting into my bicep, the pain down into here. So that's not fun. It's not bad. It's, if I've had a day where the kids needed me a lot and I like overdid it, then, I'll take a Tylenol. It's a lie, not a Tylenol, like 3 Tylenol. Who takes 1 Tylenol? Or I did take a Vicodin yesterday because it was just like achy and I was unhappy. But really the most pain I would say that I have at this point is my back. And I can kind of sleep on my side, so that's nice. But I did the math, and well, I didn't do the math. Google did the math, but it could probably be verified. But I added, so going from my previous implants, which were 325 cc's, going to 575 cc's, I basically added like a pound almost. I feel like I should double check that, but I want to say the difference between 325 and 575 equated to half a pound, then, so both, they're the same. So a whole pound. So I have noticed I'm hunching, and so I'm very eager to get back to training back in the gym because it's one of my favorites, and I feel like now more than ever my back needs to have a little bit more strength and ability, and so it's frustrated because my chest is pulling forward and I'm sleeping funny, and my movements are a little bit more not careful but different, I guess, because I'm trying to like kind of protect myself. I don't know if you've ever had any other surgeries or anything, or like physical therapy, but like when I had to do shoulder physical therapy, I was a huge pain in the ass because I guard. So like when my physical therapist would go to move my arm, if I knew it hurt to go past here, I would subconsciously lock up and like, fuck you, you're not moving my arm. Sorry. And so physical therapy for me was like mental just as much as it was physical, because I had to shut that down and just be like, Christina, just suck it up. And like I have a very high pain threshold for things like having kids naturally. I can do that like a champ. Having my stitches taken out yesterday, I didn't like cry or anything, but I was like, I felt bad because I'm laying there and she's taking out my stitches. And I was like, I'm sorry, but I'm going to scroll through Instagram right now because I need to ignore what you're doing because it hurts. Like that stuff hurts. I cried like a baby when I pierced my nose. God forbid you have to give me an IV. Oh, I'm the worst. I hate it. It's so painful. Got a text message. Sorry. I got 2 text messages. So back to the story. So he was in there for like 2 seconds and he was like, okay, yeah, they're high. It'll drop. Don't worry. Obviously I'm sitting there. My boobs are hanging out. So, without them hanging out now, I'll show you what I can. So I'm sitting kind of funny. I'm sitting on my legs. Let me fix. Okay. So this lighting is helping a little bit to show what I'm talking about. So you can see this one is all the way up here and this one is like here. So it's fallen, which is obviously the goal. So, my doctor he says, no bras for 3 weeks. Which, by the way, when you add a pound onto your chest, I've never really worried about bras, but like, God, I would kill for a bra, man. Like, but his thing is that let gravity pull the implant down. So I'm not going to lie, I've cheated and worn a bra a couple of times because by the end of the day, like, they need some assistance. But I'm trying to listen to him. So he had said, go out and buy like tank tops like this. Camis with no shelf bra, so there's no like thing along here. You know how they have those? And so it's hard because I checked realself.com, which is great if you're getting plastic surgery done, because a bunch of surgeons and patients are on there having like forum conversations. And, like some surgeons say wear a bra all the time so you don't bottom out. My surgeon says don't wear a bra, let them fall. So I got a double bubble with my previous surgery, which is basically where your boob goes like this and then this. I don't know if that makes sense. So I don't want that to happen again. So I've kind of been, like I said, when I feel like I need the support, I've been putting on a lightly supportive bra. I'm not doing like the crazy like compression strap them down, but it has helped me at the end of the day to kind of just give the muscles a rest, which is so stupid. Like it's hard because, I want the muscles to give and I want gravity to pull the implant down, but it hurts. So it's kind of one of those things where I'm a big proponent for, do what in your mind feels right for you within like smart limits. So sometimes I put a bra on, even though my doctor said no bra for 3 weeks. So big rebel over here. I did get these tank tops though at Costco. They came in a 2-pack for like $7, and I'm in the small, and I'm 5'7" and like 140, and who knows what bra size I am now. However, on that note, the lightly supportive bras I've been putting on are my old Lululemon Free to Be Wilds, and I think I wear an 8, either a 6 or an 8 in those. They still fit. So, I mean, of course, the implants are super high up, so maybe that's why I can still wear them, but I'm kind of actually excited I can wear my old bra still. I don't have to go rebuy everything. And then, of course, I'd never wear real person clothes, so that's not really affecting me. So, yeah, he came in, told me just keep not wearing a bra, keep, be careful. He was like, walk, walk, walk. He wants me to be, he keeps saying miles. He's like, whatever you're doing now, double it. But like, little does he know, I've been going to the gym for 2 hours a day and doing cardio that entire time. So I don't have time to double that. And I have 2 small children, so I'm basically never not walking, except for now because they're napping. So there was that. And then the most exciting part, I got cleared to train legs. So I am allowed to do machines. I cannot do anything where I have to, I'm not even going to like pretend to do it, but like squeeze. I don't want to squeeze my muscles because that'll hurt. I can't do anything like, so I can't hold weights and do lunges. I did walking lunges, until I just couldn't do them anymore. And it took a lot fewer than I thought it was going to before I was really tired. So body weight walking lunges, if you are like really focusing on getting that stretch and getting into it, can burn you out pretty quick. So today, that is what I went and did. I went and did some cardio, and then I did a bunch of walking lunges. I did some leg press. I did, since the leg press hit my quads pretty hard, then I did some leg curls to hit my hamstrings, some body weight squats, and did more cardio. Still not getting my heart rate up super high. I'm sitting like at the very bottom of my fat burn zone, just because I'm crazy like that, and it makes me feel better about wandering on a treadmill forever. So yeah, he cleared me for training, and then he was gone. He was literally in the room for like 2 minutes. I like him, but his bedside manner is like kind of bizarre. Front desk staff sucks. Okay. Dr. Newman, Marietta, great surgeon. His front desk staff has got attitude like no other. So I hate to call them out, but like maybe if they ever find out about this, it'll help. But like, they're just rude. I don't like that. And I talked about that a little bit. You might have seen it in the clip beforehand from when I was in the office. So then she came in and took out the stitches, and she was like, did no one have you come in to loosen your stitches? And I'm like, no, is that a thing? And I had noticed, so again, if you've ever had surgery before, like with my shoulder, I don't know if you can see the scar. See a tiny little scar? So that's how they repaired like my whole shoulder. I've got another one in the back. It was like 3 or 4 loops of one stitch, and they just cut it, pulled. I thought it looked funny, but so they did the nipple incision. Apparently it heals better. Before I had the under the fold one. It was like 10 individual knotted stitches, which is stupid. I don't know. Maybe it works better, but it was really uncomfortable to get cut out. And it explains why they looked so angry, because they looked like they were, like my skin looked so angry while I had those. Apparently, which is why I guess normally they would have you loosen them, or they would loosen them obviously, but nobody ever told me to make an appointment for that. So that was it. They said I'm not supposed to pick up Cora for another 2 weeks. So luckily I've had help there, and my daughter's miniature, so she's pretty light. Riker, my 3-year-old, has been a huge champ and a very big help, besides the fact that he's always talking. And but he's a big boy, so he can get in and out of stuff. He can get stuff for me. He can play with his sister when I need her to just be quiet because mom can't pick her up. I went to Sam's Club all by myself after, and obviously, was very careful lifting like spinach. And I mean, today I feel great. Like, we're having a bit of an ant problem upstairs in my son's room because he likes to eat Cheez-Its and make a giant mess. So the ant guy just came out and sprayed again. But Riker was like, mommy, there's buggies in my room. I'm like, no, you're crazy. And then I went and checked, and sure as fuck, there's so many ants. So I freak out, and I'm moving furniture, and I'm vacuuming, and I had to carry the vacuum upstairs, which obviously is heavier than I'm supposed to be doing. And then I moved his dresser, also something I'm not supposed to be doing. But like, it felt okay. Like, at no point was like, oh, I shouldn't be doing this. Like, it was fine. So like I said, I generally heal like a champ. So maybe that's what's happening. But obviously in the gym and with Cora and stuff like that, I'm going to continue to take it easy. Beyond that, I mean, it's been really easy. I stopped taking the big pain meds around day 4 on a regular basis. That being said, there have been evenings where by the end of the day, I have taken like a Valium before bed, which is the muscle relaxer they give you. Or like yesterday, I took a Vicodin. And so it's like one pill a day, maybe at night, if it's just really bad and I know I'm going to have trouble sleeping. Like I said, my back, I was doing cardio today and my back spasmed so bad. I seriously thought I was about that, either like something was wrong or I was having a heart attack because it hurt right here. So it was like spasmed through my back into my rib cage. I was like, I'm dying. So I stopped doing cardio and went and stretched, and then I was fine. So tips for getting to the 1 week mark and feeling good. Listen to your body. Eat good foods. Surgery and recovery are catabolic events, and you cannot starve yourself during this period, especially if you are fitness minded and you're frustrated because you're not moving as much. Think about the fact that just like when you have a heavy workout, your body needs rest. That's to repair. You have to eat and you have to rest to repair from your workouts. Well, when you have surgery, you've got to repair. You want to heal. You have to eat. You have to drink water. Jesus Christ. Water. So I keep this nearby. It's worn off. That's how much I love it, from NutriShop here in Temecula. So it's 25 ounces. And I drink one in the morning with my powdered multi. And then I drink an intra workout shake for my cardio, which normally I wouldn't fuel my cardio with carbs and protein, but I have been since I'm recovering. And then I have another one with BCAAs, and then I try to round it out with just plain water after that. And so I get to about 100 ounces a day. And that's been really helpful, I think, with healing as well. Hot showers. So I was cleared to shower 2 days after surgery. That's helped keep me sane for sure. I also like to take baths a lot. I'm crazy. We have a giant bathtub. But I'm not supposed to get the incisions submerged. And so I've not been doing that. But what I have done is taken washcloths and laid it up top to kind of help the muscle chill and relax. So that's pretty much it as far as the augmentation is concerned. I go back next week again, so that's nice. With my first one, I was 20 and did not value my doctor at all. Apparently, I went to I think I had dissolvable stitches, and I don't think I ever went back. I never went to any of the appointments. I might have gone to one. That was it. So that was stupid. And so obviously I'll be going to all of my ones this time around. But beyond that, it's not obviously it's different for everybody, and I'm lucky because, like I said, I heal like a champ. I have a high pain threshold, but really, if you prepare for it and you take it easy when you need to, and you listen to your body and you make smart choices, it's not a difficult surgery to recover from. I'm just really eager to get back to normal training, and obviously that's going to be a couple weeks. So, yeah, that's all I have for today. So I'll keep you guys posted. Sorry for my nasty post-gym hair. But the bug guy was coming, so I didn't have time to wash it and blow dry it for you. So I hope you guys enjoyed it. Sorry it went a little long. We're like 20 minutes. If you liked this, please hit like and subscribe. And comments are always welcome if they're nice. And I promise there will be other ones that are not just about my boobs. So hopefully that's not a disappointment. But there will be other vlogs. So bye guys. I'll talk to you soon.